This is Pukeology Podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up-chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
You're beautiful. Yes, you are beautiful, and you're glowing during this pregnancy. Have you ever wondered why? Well, I'm about to tell you how your skin changes during pregnancy. The good, the bad, and the ugly. In today's Pregnancy Glow, skin conditions, and so much more. Episode 47, Pregnancy Pukeology Podcast. Did you know over 78% of pregnant moms have trouble sleeping at night? If you're lying awake in the middle of the night, tossing and turning, unable to sleep, then you should check out the Sleepy Lotion from 8 Sheep, a body lotion typically formulated to help pregnant moms sleep better and also helps with common pregnancy pain like restless legs, leg cramps, and hip and back pain. Over 40,000 moms have used this lotion and rated it 4.8 stars. It comes with a 60-day money-back guarantee too. And if you're not 100% satisfied, you can return the jar for a full refund. Go to 8sheep.com to check it out. That's the number 8 and the animal sheep, 8 Sheep. Love to save on this pregnancy cream? Get 10% off now with code NOMO, N-O-M-O, at purchase at 8sheep.com. If you want to hear some hilarious pregnancy humor that may just make you want to pee your pants, like you don't have to pee all the time anyway, with crazy stories like pen poke, bend over, and CVS. If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind what gives you that pregnancy glow and weird skin conditions that no one talks about during pregnancy, followed by a list of unsafe makeup and hair care brands that you need to avoid right now.
The science of puke, pukeology.
Are you looking for a perfect glowing skin during your pregnancy? Well, some females are lucky enough that they get this beautiful glow, but a lot of things happen to your skin during pregnancy. So I can't say that everyone's going to stop you and say, wow, you must be pregnant because your skin looks perfect. Babies do some very interesting things, especially with hormones. So you have to remember that a change results in the levels of your hormones, your blood flow, meaning sometimes swelling, around your feet and face, and for instance, your pigmentation because of this increased amount of blood flow to certain areas. This is what I like to call pigmentation skin, aka pregnancy skin. The area around the genitals and the inner parts of the thigh get pigmented, meaning a change in color. Females may also experience different forms of skin problems, including rashes, acne, redness, discolorations, and other skin eruptions. Changes usually don't appear until the 2nd or 3rd trimester of pregnancy. This pregnancy skin is a scenario in which you are facing any, some, or all of the above in your pregnancy problems. These skin changes are very common, and it is quite unusual to experience no skin changes at all during your pregnancy. So you have to remember that pregnancy is beautiful in all ways and forms because you're going to get the most amazing gift at the very end of it. The best things that I can say is that if it doesn't resolve or change within weeks, especially getting closer to your due date or delivery, you may want to go see a dermatologist also because of hormones. And I'll give you a for instance on myself. I have really bad eczema. I've had it since I was a kid. Unfortunately, I never really grew out of it. And during pregnancy, my skin was honestly perfect. But up until nearing the last month of my pregnancy, all of a sudden I started getting a really bad flare-up. Now, physicians, especially dermatologists, are concerned because what is the largest organ group? Your skin. So you don't want to be influxing so much of the Benadryl, the Zyrtec, the hydrocortisone cream, things of that nature. So go see a dermatologist if it is a skin condition after you've talked with your OBGYN. Now, pregnancy hormones, called progesterone in particular, is responsible for releasing a lot of oils from your pores. It's also what causes you to itch your belly all the time, aka. And if you want more information on that, there's actually an entire podcast that I dedicated to it, Pregnancy Itch. It's on episode 43, so you can definitely go check that out. But progesterone is responsible for releasing a lot of oils in your pores, even if you are a very dry skin person anyway. And this gives you much more tendency to have rashes, discolorations in various parts of your body due to this high progesterone surge, especially during the beginning of your pregnancy. Now, it will change and go up and down in the amount of progesterone hormone concentration, but especially when you first find out that you're pregnant, boom, you'll be like, whoa, I've got acne, weird stuff is happening. And the whole reason why is because you want to keep that baby, right? So progesterone hardens the walls of your actual uterus itself so that they're not just like ever fluid. Instead, it wants to grab on to that fertilized egg and hold on for dear life. It's like your cement in your uterus. So your body responds to that by producing a skin change just to make sure that you say, yes, I'm keeping this baby. So why am I having pregnancy rashes? If you've thought that to yourself, instead of this beautiful, shiny, bright, radiant skin that your skin might look like, all of a sudden you look like a teenager again who's got, skin popping up with pimples and acne and rashes and itching all over your bump and all over your body. Well, pregnancy is associated with very different, strange symptoms that you might not be prepared for. And they're not all symptoms that you have to worry about, because most of them will actually vanish in a few days after you give birth to your beautiful baby. Now, if it stays that long, like I said, if it's a full 9 months, you definitely want to go see somebody about it, because it could be something that is, it could be something that's viral in content, meaning after a virus, it could be something that's stress-related, anxiety, or that your immune system needs to be bumped up. But for the most part, anything that you've gotten weird pregnancy rashes, they should go away within a couple days after you've given birth to your baby. Remember, your skin regenerates itself every 7 days, so give it about a week. Different types of pregnancy rashes that might occur are as followed: puretic eudicardial papules and plaques of pregnancy. Whew, say that 7 times fast. PUPS, PUPPPS. Masks of pregnancy, stretch marks, acne, skin tags, cholelithiasis, and cholecystitis during pregnancy. So what is PUP? PUPPP. The most common skin condition that happens during pregnancy and causes itching is PUPS. That is puretic eudicardial papules and plaques of pregnancy. These patches usually appear all over and especially around stretch marks due to term, like whenever you're in your 3rd trimester. These patches may spread towards your arms, legs, or buttocks. This condition causes no harm, but it can be awkward and super annoying in most females. This condition also typically develops in the last trimester of pregnancy. So again, when you think you're out of the woods, it's your 3rd trimester, surprise. And they look like basically little pimples, like all over the place, especially where your stretch marks are developing. And this happens during your last trimester of pregnancy, and it can happen after delivery. Upon examination, this rash appears, which is raised red areas of patches or swollen areas of small papules that join with other forms, larger plaques. So they just get bigger and bigger and bigger. There might be a lighter halo, like a white-skinned, especially those who are very fair complected. You might actually see a lighter halo or like a bleaching around it. It usually starts on the abdomen and spreads towards the extremities. Sometimes they might present with like microvesicles. Initially, these plaques might develop as stretch marks during pregnancy. These rashes usually appear due to excessive weight gain or twin pregnancy. And if you're wondering how much weight that you should actually be gaining and like, what is it? We have an entire Pregnancy Pukeology podcast that's perfect for you. Episode 12. So stop right here, go to Pregnancy Weight Gain, episode 12, Pregnancy Pukeology Podcast, to find out how much you should be gaining. Here's a hint. If you only have one baby in there, it's about 25 pounds, 25 to 30 pounds, and you really should only be eating a yogurt and an extra fruit, which is about 150 calories extra than you normally are eating. So, during these excessive weight gain period of time is what could potentially be causing it. Now, these rashes might also appear in prima gravida, which means the first pregnancy, the first time that women are pregnant. And that is because your body is trying to interpret all of these hormones and you're just trying to figure it out, right? So your skin is that release, your exocrine of all of the hormones and everything that you are currently internalizing towards the outside. Hence, now I will tell you, I had a really good friend from high school who finally called me and said, Jackie, I need you to take a look at this. I ended up, kind of nudging her that it was PUPS, and it was weird. So she had a very raised presentation. It was red. Then she started getting flaking skin. She looked like a snake that was literally shedding her skin on top of these raised papules. It is usually diagnosed by the results of an exclusion technique by physicians and laboratory testing to rule out other dermatological problems and throughout biopsies. I mean, you can biopsy something if it gets that severe. However, these rashes usually disappear within 15 days after delivery, even without any treatment. Ladies who experience extreme itching usually get symptomatic symptoms with treatments like topical steroids at a very low concentration, usually 0.5%, anti-allergetics or systemic steroids. Again, you don't want too much systemic steroids because they are a catch-22. It will reduce your body's immunity. Hence, you're reducing the inflammation and you're reducing your body's outward expression of whatever it is that it's causing problems. Now, people are counseled that through this, it is quite annoying in these conditions. It's very itchy, they are very serious, and they should resolve immediately after delivery within a few days. Now, you need not worry as these conditions don't transmit to your baby. So I'm going to say that again. You don't have to worry because these do not transmit to your baby. So what causes itching in my body during pregnancy? Itching during pregnancy may be caused by a couple reasons, but most common reason is that your abdominal skin is expanding day by day due to your baby's bump. However, the itching can be caused by liver problems. For example, intrahepatic cholecystitis, known as an obstetric, cholecystasis, meaning that your gallbladder is just not functioning the way that it should be. Okay, and your gallbladder is what's used to break down fatty foods. So when it gets stopped up, right, when it gets actual gallstones, things of that nature, and a lot of women during pregnancy have it. Now, this condition usually can be cured, meaning the itching condition, wearing loose clothing that are less likely to irritate you. Try to make sure that you don't use any washing detergent that has any dyes or fragrances, such as like all free and clear. You can also make sure that you're using cotton clothing instead of nylon. Do not use lotion, shampoos, creams, or other skincare products on it because it actually might irritate it instead of making it better. Now, mild itching is not harmful to you or your baby, and especially whenever it comes up during nighttime. So if you are an itchy person at nighttime, sometimes it is subconscious and you're not able to stop it. Like I said before, I have eczema. I've had it forever, and the itching is very annoying. But if you need any other questions that I have not answered, go talk to your physician about these clinical issues and potentially get a prescription for all that you need.
Throwing up on a Tuesday? One puke story.
So I was doing my makeup in the car with my wonderful husband, who he kind of drives like a race car driver. Somebody needs to pick him up for NASCAR, and I'm sure we'd have a lot more money. Well, I was doing my under eye makeup and all of a sudden he took this bump. I literally poked myself in the eyeball. It hurt so bad. Ouch. And all of a sudden I started vomiting intensely all over my clothes. Now, we hadn't had a date night in a very long time, so I will tell you that this totally ruined date night. Our car smelled gross and we spent the rest of the night cleaning it out. Moral of the story is, when you're pregnant, don't try to do your makeup in the car because you have a very sensitive stomach. Thanks so much, Tiffy3, for that hilarious puke story. Bend over, as my Italian stepfather would usually say. I was sitting at the actual store and somebody on accident bumped my cart and it popped something out. Now, I was considering not picking it up. I've been having the worst upset stomach ever, and I didn't know how to calm my morning sickness. And I knew that I was pregnant, but I was really not very far along. So I just didn't, want to get sick. But I kept looking at it and it was actually eyelash glue and I really wanted it, and it's a small package. I didn't have a really big bump and there was no real reason for me not to. So I literally contemplated with myself. I can't even imagine what I'm going to look like in my third trimester. Finally, I decided. I bent over to go grab the eyelash glue and instantly pours out vomit. I looked like the exorcist. The ladies behind me were so grossed out by it. They didn't even offer to help. They were just watching this greenish sputum go everywhere. Tay, 1, 2, 3. That was a hilarious puke story. I will have to say, I don't think I've ever seen someone just go for it. They probably thought that you were just having a hangover or something. Thanks for that hilarious puke story. C, the S. Why is it that all the makeup brands all the good makeup brands that I actually want are always found on the very bottom? Well, I will tell you, I'm only 3 weeks out to the very end of my baby's eviction notice, and I'm getting rather plump. So plump, I can't see my feet. I can't try to even shave. And my husband says, my hoo-hoo looks like a jungle monkey. Whatever that means. So all of a sudden I went to try to go and kept wanting to bend over to grab the items that I wanted on the very bottom. Unfortunately, I couldn't get to them. So I kept trying all these different ways. Now, somebody decided to give me a hand, and every time I kept bending over and standing back up, I was getting almost a mild little headache. Well, the second that I went to bend over, they went to help. They looked at me. I threw my hands over my mouth and then started puking, and I was trying to hold it in while I had it inside of my mouth. That poor lady will never help another pregnant woman again by seeing the horror in her face. Thank you so much for those hilarious puke stories. Do you have a hilarious puke story that you just can't wait to share with me? Send it to me. Pukeology, Pukeology @nomonaja.com, or tweet us at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up-chuckle that you need.
Do I need to avoid any cosmetics during pregnancy? Yes, an alarming yes. This would be one of those lists and things that you don't really talk about. When you get pregnant, people don't say, you should really watch what you put on your skin because it is your largest organ group. Most beauty products contains ingredients that are actually harmful to you while you're pregnant, and they might actually cause delirious effects on your developing baby. For example, vitamin A and its derivatives may result in serious birth defects. Now, we're talking in high concentrations, but if you have a very high concentration of it and you're using something a few times a day, let's say you're a model by trade and you're constantly using it, well then yeah, especially during organogenesis, you want to be very careful. Compounds containing benzoyl and salicylic acid, which are most commonly used in acne treatments and products, those should be completely avoided. Now, there are some essential oils in beauty products that are not assessed by the FDA, and they indicate that they must have limited use during pregnancy and only used with caution. So again, not all essential oils are created equally. I know with the company Nomo wristbands, they have Nomo nausea, Nomo migraine, Nomo sleepless nights, and they utilize different essential oils from all over the world that have the highest concentration of medical. So they're actually medical grade essential oils that are utilized in hospitals. But just because something smells good or is an oil that you've never really researched, how do you know? You really don't. So only go with those who are trusted. And if you want more information about essential oils, I would definitely go check out. They have a bunch of blogs. It's nomonausea.com. Go check those out. And again, if you ever want to stop your morning sickness, they are most definitely the product of choice. Now, hydroquinolones, these are skin fairness treatments. They are usually prescribed for severe pigmentation of the skin during pregnancy or masks of the skin. Studies show that studies show that you should be avoided unless prescribed by your doctor. So again, if you have these really hyperpigmented spots, just be careful, right? Use it. I always think of, Michael Jackson changing from very dark to fair, utilizing high concentration of these items. But while you're pregnant, don't go there. Aluminum chloride is a debatable item that is used in cosmetic products like deodorants and precipitants. They are considered safe, but should be avoided unless otherwise advised. So again, aluminum-free deodorant is the way to absolutely go. There's a deodorant that I personally love called Smarty Pits. It was developed for chemotherapeutic patients because, again, you don't want all the aluminum to get trapped inside of your pores, inside of your actual underarm area. And you know that you have a lot of lymph nodes that are found in that area next to towards your breast area. So I would recommend that for any pregnant women. Chemicals in sunscreens must be avoided as they interfere with the developing brain of your baby. Make sure that you're utilizing natural type sunscreen, mineral based, other things that just have zinc oxide, right? You don't want to be clouding your body with things that are just unnecessary because they could have a developing effect because of the products are too large. And even though the woman's body goes through their liver to help, digest it and bring it down, you have to remember the baby has a very immature liver, and because of that, they aren't able to process it the exact same way. Now, tetracyclines, which are used for a lot of treatment of different skin problems, but it could harm your baby and your body, so just avoid it, especially during pregnancy. We're going to go through pregnancy safe acne treatments here and momentarily, so make sure you have your pen and paper ready. And dihydroxyacetone is an active ingredient in many sprays that is inhaled, and it can be unhealthy for you, your body, and your baby. So always think about rubbing it. Lotions are way better than anything aerosol. Itchy skin. Of course you're itchy all over. You have pregnancy hormones raging, particularly progesterone, which makes you itchy. This was such a hot topic that we dedicated an entire podcast to it. Episode 43, pregnancy skin, and why are pregnant women always itching their stomachs? Now, here's some natural itchy prevention tips for itchy skin. Keep your skin moisturized. Make sure that you change your bath habits. Take warm to cool baths or showers. Hot water will actually make it more itchy. Wear comfortable cotton-based clothing and make sure that you're washing those clothing with a non-fragrant detergent. Use gentle cold therapy, especially upon your skin. Soothe your skin with some aloe vera extract. Maintain good, proper nail hygiene. I can't explain this enough, especially during this pandemic. We want to make sure that our nail beds are clean because you can be festering lots of bacteria underneath of it. Moisturize with natural oils. Olive oil is a great one to be utilized on the skin. Make sure that you're using some sort of humidifier in the room, especially when you're in your third trimester, because you'll get a little nasally because you have so much more blood flow going through. Avoid known allergies and manage your stress because the health of your baby is directly related to your health. Now, makeup brands that must be avoided during pregnancy. If you haven't written down anything. Or if you want to go nomonaja.com/blogs, you will find this entire list. All right, here it goes. Glossier. I know we love this makeup brand. I get it, ladies, but some of the products, including their Super Glow Face Moisturizer, their Haloscope Bronzer, Highlighter Pen, Paintbrush, Milk Jelly Cleanser, and the Stretch Counselor, those need to be completely avoided. CoverGirl. Don't use their lip and eye products. Listen, I'm not trying to pick a fight with any of these companies. I'm trying to look out for your best interest. So for me, your baby's health and your safety is much more important than any of these big name brands. Tell them, come see Dr. Puke No Mo if they want, if they have any questions, or if they can provide other ingredients in it to where they could change it and create a pregnancy line. I'm all up for it. NYX Professional Makeup. It has good ratings, but use caution and read these ingredients carefully. But they are the least harmful among all the other makeups, which is interesting because I know that they are sold at a lot of the pharmacies. ELF products are cost effective, but need to be double checked again for their ingredient list. Make sure that none of those 7 that I had listed before. Maybelline has a lot of really good makeups with a lot of good ratings, but take caution while purchasing and observing their ingredients. Just take a look at it. I would go into an Ulta. I would go into a big store like that where you can ask someone and talk to them and ask them which ones have the least number of additives and fillers. Benefit, most contain out-of-date formulas except for the brown liner. So the brow liner is okay. That'll, buff up your eyeliner there. MAC, unfortunately, does not offer any clean formulas. I know myself, I can't use anything but Clinique. I'm not trying to brand push here, but it is really good for sensitive skin. Tarte. Yeah, they have a moderate scoring, and there are some hazards that they found in it. NARS, N-A-R-S, gives it a moderate, again, for some hazards. And Bobbi Brown actually has some good options, surprisingly. Do hair care products need to be avoided during pregnancy? Yes. Do not use dyes, highlighters, extensions, permings, and other hair treatments that happen to use this extensive chemicals because you're getting it inhalational, which obviously gives directly to the baby. I would suggest wearing a mask inside of nail salons. You have to wear a mask anyway now during COVID times, but keep that up. Okay. A few types of research restricts their use, but others will allow you to. So you need to just be extra cautious. In my opinion, these treatments must be avoided, especially during the first trimester. That's when your baby's organs are being made. So just shy away from them. Now, the types of shampoos to stay away from. They're just like cosmetic problems because what do shampoos do? They go throughout all of your body from the top down. They also contain many ingredients that must be avoided, including quats. You heard me. I called it a quat, Q-U-A-T-S, or chemicals A-D-B-A-C and D-D-A-C because those can cause birth defects. Just remember, anything that sounds like alphabet soup causes birth defects. Just don't use it, ladies. Sulfates, they strip your hair of its natural oils that can damage hair. So again, you want to stay completely away from it because it actually could strip the natural oils from your baby's hair, not just your own. Parabens, containing hair loss due to hormonal imbalance that are caused by them, also known as PABA. It's found in a lot of sunscreens. I'm actually allergic to PABA and fragrance. So I will tell you that I go with the most natural of all. And alcohol, not the drinking kind, but based on different shampoos and hair care products that cause hair dryness. And the last thing that you need on top of your itchy skin is having, hair that's falling out as well. So if you're worried about your stretch marks, don't be. There's nothing that you can do about it other than keeping your skin moisturized. And if you have a genetic characteristic of like your mom, for example, your mom's sister, your grandmother, they all have stretch marks, then you probably will have stretch marks. It's a genetic condition as well. During puberty, if you had stretch marks really bad, pregnancy might leave some battle wounds. So FYI, if you're curious and want to know more about it and want to know more about the science, check out episode 27, Pregnancy Stretch Marks, for all the products that are safe and actually work too. Botox. I know we ladies are having babies later and later. Again, advanced maternal age is at 35, but no clinical event suggests that Botox is unsafe during pregnancy or breastfeeding, but caution should be taken to practice that it is a toxin and that being injected into your body, it is actually a neurotoxin, meaning you are telling your muscles to relax. So it is a relaxant, okay? So that you can't scrunch up your muscles anymore. And it hasn't been researched very much because there's very limited data, but I would just say stay away from it. You've got a beautiful baby bump. So what? Give yourself some facial expressions during your pregnancy. Now, if you have pimples, what can you start using? Is there like an acne medication? Let's talk about it. Medications that are used for acne treatments cause birth defects to babies. Medicines like retinoids and isoretinoid are contraindicated during pregnancy. Notice they said contraindicated. They are actually said, no, you cannot use them. However, if you still want to use acne products, you need to get them prescribed by a doctor. Acne treatments, products containing benzoyl peroxide are safe, but those containing salicylic acid must be completely avoided. Here's some natural things that you can do: apple cider vinegar, baking soda, citrus fruit, honey, coconut oil, and oatmeal and cucumbers. Those are all some natural ways to help to avoid acne. If you want to go more into it, you can take a look at the previous podcast. Skincare to avoid during pregnancy. Yes, you want to look beautiful as before with flawless skin, but the following ingredients contain treatment products that must not be used during your pregnancy: retin A, salicylic acid, tyrosic, benzoyl peroxide, different essential oils that have not been tested by the FDA or that are unregistered products, hydroquinone, aluminum oxide, formaldehyde, which is found in nail polish, ladies. So make sure you have formaldehyde-free nail polish, chemical sunscreens that have lots and lots of chemicals in it. Try to stay with more mineral and more natural, tetracyclines, and dihydroxyacetone. Now, I've given you a lot of no-no lists, but always go with natural. If there's something that you can do, again, go with nature. They invented it first, right? And then we just added a bunch of other stuff to keep it good on the shelf. So I'm always the person to say, be a natural beauty, because you are one. And now that you know the science behind why your pregnancy skin glows, why you have weird pregnancy skin problems, and which makeup brands, especially hair care products, to avoid during pregnancy, you're best able to get through these 9 months with me together. If you love Pregnancy Pukeology Podcast, let me know with a 5-star rating or hearts for likes. Don't forget to download this episode, but more importantly, share it with all your Prego friends. Thanks again for listening to Pregnancy Pukeology Podcast, episode 47, Pregnancy Glow and Makeups to Avoid.
Pukeology Podcast, edutainment at its finest.